Federal Ministry of Health and the NCDC should take out a critical mass of medical laboratory workforce and train them. 2, the Federal Ministry of Health should drive the process of upscaling testing centers, upgrading some of our teaching hospitals to have capacity to test. You asked about...
It depends on how long this upgrading will take.
You asked about cost. Currently, because of what we have, what was bequeathed us by donation, we are using the real-time quantitative PCR. There are other screening methods. What can we do? When you train this medical laboratory workforce, you will have a cohort of the group develop an algorithm that will support screening, massive screening. Screening should not be made to look like a thing that is exotic, that can only be gifted to privileged persons who are now down. Now, if you go to Sweden, they have the drive-through screening method. If you go to South Korea,
drive-through,
just like
you stay in your vehicle.
No, yes, like you go to some eateries, they have a drive-through.
Drive-through, you buy why inside your vehicle.
That same model, why inside your vehicle, you are sampled and you drive away. You are not sick. You see, the testing will help us fully characterize the pandemic status in Nigeria. Like Dr. Robertson said, we do not really know the prevalence of COVID-19 in Nigeria because you are basing your prevalence, your incidence rate on the privileged few that have been tested. No, that is not how to do disease containment. In the US, the drive-through process is on. In South Korea, it helped them keep incidence rate very low and it declined. In China, it's been practiced. Dr. Robertson talked about fumigation. I rather support him, but would insist that decontamination would work better because we are dealing with virus and we also know the kind of thing in parentheses we call fumigation in Nigeria. Now, having said...
Those fumigations, are they strong enough to do with
the one we do here in offices and schools,
yes.
that is deception. It's cosmetic. Watch what countries that have been able to keep this virus low.
But sometimes they're strong enough to deal with insects and rodents.
Yes, they are strong. Let me tell you. You see, I would rather emphasize repetitious hand washing than the business boom we're given to hand sanitizers. You are dealing with a virus and you are using an alcohol base as what you want to use to destroy virus. Those who understand the language I speak will know.
We are told that 99.9% of these germs, at least on the bottles.
No, that is the gimmick for selling that product. Every rounded microbiologist knows the effect of alcohol on virus and does know the chemicals that have capacity to destroy virus. So, but for me, it is promoting hand hygiene. And that is very, very good.
A cheaper method.
Well, it's not cheaper than washing your hands.
No, I mean washing of hands is cheaper than
and it's more affordable. And it can be done everywhere. A repetitious wash, even if you wash every 30 minutes or 1 hour.
With soap, ordinary soap or antiseptic.
No soap. You see, the point need to be made that why we strongly feel we have issues with this is because of inadequate testing. Now, I talked about developing an algorithm. A few medical lab scientists and some other scientists could sit and look at all the testing options available now and develop algorithm and use cost to determine what we can fully encourage, promote, and deploy for basic screening so we can commence somewhat drive-through screening. People will tell you, oh, it's not good to screen the population. It is very important to do a massive screening of the population. It fully characterizes the pandemic. Without a full characterization of the pandemic, we may be playing with a time bomb. And the reason for this is that since more than 2 decades now, there's been a concerted effort to destroy our medical laboratory system and structure. And the point need to be made that while we had occupied the rock bottom 182 out of 184 countries in the world that are ranked annually in the last 2 decades.
In terms of
health system ranking, is because the strongest link of any health system is the medical laboratory structure and network. And that is not
That's a diagnosis level.
Exactly.